pregnancy is often seen as a joyful and hopeful time, but for many families, that journey is interrupted by heartbreak. Miscarriage and stillbirth are deeply personal and often misunderstood forms of pregnancy loss that affect millions around the world, yet they're rarely talked about openly. Returning today to help us get a better understanding is Dr. Stephanie Hack. Thanks so much for joining us.
Thanks for having me.
So tell me a little bit about what exactly is a miscarriage and stillbirth and what actually happens during that time.
So a miscarriage is any pregnancy loss that you have that occurs before 20 weeks of pregnancy. And then a stillbirth is any pregnancy where the fetus or baby dies after 20 weeks and before birth.
Gotcha. And tell me a little bit about why those things actually happen. What is going on with a woman's body that it is causing a miscarriage?
The most common reason that women miscarry is because of genetic abnormalities. So it most commonly happens in the first trimester, 13 weeks or earlier. And for stillbirth, we don't know often what happens. It could be infection. It could be a problem with the placenta. It could be issues with baby growing or chronic conditions related to the mom. So things like high blood pressure and diabetes, all of those things could potentially cause a stillbirth.
Gotcha. Now, when a woman is pregnant, are there any warning signs of a miscarriage or stillbirth? And can a woman be absolutely healthy and still go through these things?
The most common way that we know that someone might miscarry is they begin to have bleeding and pain. I'd say that's the first thing that we realize when someone miscarries. Now, sometimes someone can go in for an ultrasound and find that when they had an ultrasound with a fetal heartbeat before, they come back and there just isn't one. And then they'll experience those other symptoms. With stillbirth, women often report not feeling the baby move as much, and then they might not feel the baby move at all. And then we go and do an ultrasound and confirm that there's no fetal heartbeat. And it can happen for someone who is completely healthy, and most of the time, they're completely healthy.
Gotcha. And so how can family and friends support someone who's gone through this? I mean, usually people or women are usually, quiet about these things. They don't want to share that information. But if someone does share that with a loved one, how can they support that friend or family member?
You're so right. There is a lot of shame around miscarrying or stillbirth, infant and pregnancy loss, because our initial instinct is there's something that I did. What did I do wrong? And then you start kind of playing that through your head. And then many people have never had that experience, thank goodness, although they are relatively common. At least miscarriages happens in about 1 in 10 known pregnancies. Stillbirth is fortunately less common, but still happens in about 1 in 160 births. So as common or uncommon as they are, people still don't really know what to say. And it's really a matter of acknowledging and listening. I think those are the two biggest things. And fortunately now we have more resources than we did in the past. I volunteer with an amazing organization called Stillbirth and Infant Loss Support and Awareness. And they provide resources. And so having that conversation with your healthcare provider, having that conversation with your OBGYN, your midwife, they can often point you to resources to help.
Yeah, I was going to ask you about those like support services and things like that. Are there support groups for women that have gone through that?
Yes. SAILS, the organization that I mentioned, Stillbirth and Infant Loss Awareness. So what we do is we do focus groups. So often what people need to do is they need an opportunity to talk, and they need an opportunity to talk to someone that's had a similar experience. And there are many support groups like that, not just that particular organization. So looking locally for a group like that, and then your OBGYN or midwife might be able to point you into the direction of something like that. In your hospital, sometimes they can point you to support groups. So there are resources available for people who want to talk more about it.
And lastly, why is it so important to talk about pregnancy loss?
Because before, as we kind of talked about, there's a lot of shame about it, a lot of guilt. And it's really important that moms know that it's not your fault. And if you're having these conversations in isolation, if you're not talking to anybody about it, you just kind of carry that with you. So you need an outlet. You need support.
Absolutely. Dr. Hack, thanks so much for joining us again. We really appreciate it.
Thanks for having me.
All right, for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.